Coming back to one of our top stories again this morning, there are now 6 Calgary daycares under new closure orders. More children have tested positive for E. coli. Those orders were released in Saturday's update from Alberta Health Services. That's the most recent we have. They are believed to be secondary infections, not connected to that shared kitchen believed to be the source of the outbreak. The number from that Saturday update, 342 lab-confirmed cases of E. coli in Calgary. Let's begin the week with another conversation with Dr. Stephen Friedman, who joined us on a couple of important moments last week. He's an emergency physician at Alberta Children's Hospital, and he is, as we've talked about, a world authority on pediatric E. coli. Dr. Friedman, welcome back to our program.
Hi, good morning, Heather.
342, that's the case number we have, again, as I mentioned, from Alberta Health Services, and that's the last number. We would expect an update today, I would imagine. But what we've understood from authorities is this is a result of secondary infections. What's your understanding of what's happening, Dr. Friedman?
Yeah, so we've seen kind of the real peak of the initial wave from the daycares where they had the shared kitchen with the outbreak. Now we're seeing much smaller numbers daily, fewer children presenting, many children being discharged from the hospital. So the numbers are going down. Many of our clinics where we have created to manage the large number of patients, the influx, they've actually started to close down or reduce hours, which is all great news. But any secondary case is really obviously undesirable. And unfortunately, we do see that S-tech or Shiga toxin producing E. coli has about a 10% household transmission rate. So we have seen some of those cases. But importantly, and also to clarify, from what has been shared is that the cases seen in these new daycares are actually children from the original outbreak who actually have attended these other daycares, despite actually orders against that being done at this point in time.
Yeah, that's a key thing. And the Premier confirmed that on a radio show this weekend, that the parents had sent their children to these daycares that weren't affected, and this seems to be the source of these infections. They were supposed to be cleared, were they not, in terms of both the children and any staffers before going back into the daycare environment? And obviously that didn't happen. But is it possible that, are they asymptomatic at this point, Dr. Friedman, or how would that have occurred?
Yeah, obviously I can't comment and don't know details of any of the specifics of these cases. But, there is a complex process, and given the large number of children infected and the mass screening that was performed, I've heard numbers over 1,100 children were screened. There's a large amount of contact tracing, results sharing that has to go to parents. And in the ideal world, actually what's supposed to happen is all these children should be testing negative, some of them twice even, being provided with a letter saying they are now allowed to attend daycare before they go to any daycares. What it sounds like has happened is some of these children, in the absence of having that letter, were put into new daycares and attended those daycares. So they were children positive initially from the original outbreak, did not have clearance from the government, or from public health, I should say, to attend these new daycares, but did so. And in theory, although we can't confirm, that puts at risk children in these other daycares in a manner similar to a household by causing secondary transmission, in this case in the daycare setting instead of in the household setting.
So what do parents need to know, Dr. Friedman, at this point? Remind us of the procedures to reduce infection.
Yeah, so, the most important, obviously keep an eye out for your child. So if your child has been exposed to a known case, if your child has any diarrhea, they need to be seen right away. And in general, any kid, any time who has bloody diarrhea, they need to be evaluated. I do know that public health was screening all the children in these daycares as well. So that should be happening, or have already happened. So that would be okay. But really important in your household, if you do have a child or you're worried about it, it really comes down to measures, right? So keep your ill child at home, keep your child separate from other children, from yourselves as much as possible. Make sure you're sanitizing things. And in the case of S-tech, it can live on surfaces. So cleaning things with a mild bleach, and there are instructions on the website of how to clean products at home, whether it be toys that might be shared between children. And similarly, daycares should be following the same procedures as they always have been instructed to do.
That's a good reminder. That website, Alberta Health Services, set that up at the time of the initial outbreak, and it's been a valuable tool for information. Alberta Health Services website for parents. Let me ask about the hospital situation, Dr. Friedman, before I let you go. You'd given us the first real indication last week that things might be turning in the positive direction, and indeed the number we have this morning going down. Now 12 children in hospital, 10 of them with HUS, that hemolytic uremic syndrome that we've talked about, that serious complication. So that seems to be good news to me. What will you be watching for as far as hospitalizations as we begin this new week?
Yeah, so gradually those numbers should come down. Many of the children, though, unfortunately, who are still in hospital are on dialysis. And so that really is a wait and see as we hope that their kidneys start to recover. They start to urinate on their own and can actually gradually be weaned or have the dialysis reduced. That is the ultimate hope that we can have, because we do know that the duration, the longer they are on the dialysis, the longer they are unable to urinate on their own, the greater the chance of developing chronic kidney disease, long-term complications. So those children might grumble. Some of these numbers will stay up for a little bit for a while and gradually decline slower than the initial reduction from the early phase, because these are the more complicated kids who had a more challenging course. And really what we can hope for now is that their kidneys start to recover and that these children can all go home.
We'll be following that with interest again this week. Thank you, Dr. Friedman, for the very latest.
My pleasure. Thank you.
Dr. Stephen Friedman in Calgary this morning.